Well, we have reached the final keynote of our day, and we are so honoured to have Dr. Michael Orlowski with us, the father of wellness coaching, to conclude our celebrations today. I can't think of when I've had a better birthday party, really. For his many, many contributions to developing the discipline of health and wellness coaching, Michael's accolade of father of wellness coaching is truly deserved. Michael is one of the key developers of the field of wellness coaching. He's a founding board member of the National Board for Health and Wellness Coaching in the States. He's the founder and CEO of Real Balance Global Wellness Services. And of course, he's the author of 2 seminal books on health and wellness coaching, which have helped and are helping thousands of us coaches to develop the wisdom and tools to deepen our craft. Today, Michael joins us to share this wisdom on how health and wellness coaches, whatever their level, can deepen their craft. So before we kick off, let's just have a quick reminder about the questions. The chat will be open throughout the session for questions. Please don't use the chat for general conversation so that we can get to as many of the questions as possible and put them to Michael. If there is something that hasn't been answered or you think of something afterwards, please email us at info@ukhealthcoaches.com and I will make sure that the questions are passed forward to Michael. So without further ado, everybody, please welcome Dr. Michael Orlowski.
Thank you so much, Isabella. I'm really honored to join your conference and kind of put the capstone on it because it sounds like it's been a marvelous day. You've been telling me about how even you, with all your advanced knowledge and everything, have been taking notes furiously, learning so much from all the speakers. And that's exactly what we want to see with this kind of thing. And it's exactly what we want to see with the topic that I'm talking about today. How to really take this discipline of health and wellness coaching to a higher level. And the way we do that is by taking our own craft to a higher level. And I really believe that the time is now for us to do that. I think we are way beyond SMART goals, and just goals and accountability. And what are your goals for the week? And, that's fine to get started, but we have already started. We've actually gotten to the point where health and wellness coaching is a well-established career, it's a well-established discipline, and we've got the research base now to be able to speak confidently about its efficacy. I remember when I was just kind of getting started with this, and some of the critics were saying, well, there's no, journal articles of, double-blind studies that say that it works and so forth and so on. Well, now we can say there are hundreds, yes, hundreds of studies that show that it really is effective. And that's really rewarding, to say the least. So we're kind of beyond this infancy level. It's still a nascent, profession, for sure. We haven't been around that long. The International Coaching Federation was only founded in 1995, but we have come a long way. And what I want to share with you today is where are we going from here and why do we need to up our game? So let me go ahead and bring this up to full screen and just share with you this whole idea of going beyond the basics and becoming more masterful at the work that we do. There's a real reason to be doing this. The world needs it. And I will never forget being contacted by a gentleman from Ethiopia who was a physiotherapist there and wanted to become a health and wellness coach. He'd actually somehow come across my book on the other side of the world. And he said to me, the reason we're doing this is because we are faced with both an infectious disease epidemic and a non-infectious disease epidemic, lifestyle disease. His name was Mulugeta Baisa. And what he was talking about then was way pre-COVID. This was a number of years ago. And yet Today, in this COVID world, it's even more of a factor that we are faced with both infectious disease that we have to deal with, but also it's, as you might say, as important as ever, maybe even more important than ever, that we look at how our lifestyles affect our health. There is an absurd amount of evidence that our lifestyles affect the way that we deal with illness, both preventatively and the course of an illness. You know, I'm a member of the American College of Lifestyle Medicine and presented there a number of times. And the whole emphasis of lifestyle medicine is that the way we live our lives affects the course of an illness. So our lifestyle improvement can actually be a method of treatment. Now, with that in mind, what's really critical here is for us to face the challenge of more difficult clients dealing with lifestyle disease without becoming over-medicalized. We don't need to be better psychologists or better medical people. We need to be better coaches. And here's what I mean. When we look at the people that we're working with and the challenges that they have, we see people with all kinds of stress-related illnesses. Stress is the exacerbator of practically all health challenges that we can think of. And it's not hard to look around and, you know, discover the sources of stress that we have today, greater than ever. But we're also dealing with tremendous disparities and differences from place to place, community to community. The social and environmental determinants of change are something we've been studying now for a good while through sociology and psychology and so forth. And we can really see that the epidemiology of a lot of these lifestyle related illnesses can be really determined to a great degree by where we live and how that affects us, whether we have adequate access, how challenging it is, how easy is it to be healthy and well. You know, I grew up in a river town about 40 miles from Pittsburgh, which in those days was the big steel capital of the world. And it was an industrial part of the Ohio River Valley, and it was thriving. Now that area is in tremendous poverty. There's very little in terms of public facilities to be healthy and well. I've since moved to Fort Collins, Colorado, where it's extremely easy to be well. So we have to take this into account when we're coaching people and not just assume that everybody has the means, the ability, the access that everybody else has. But we're also seeing that this list of lifestyle illnesses is expanding. This is also part of the challenge we're facing. We're seeing more clients with multiple comorbidities, where it isn't just one thing that the person's dealing with. It may be 2 or 3 chronic illnesses. And of course, the effects of this global pandemic. That has affected people in so many ways. While on the one hand, a lot of our coaches have reported clients saying, you know, this has actually been a way for me to take stock of my life and really discover that I need to do more for my health, to really be healthy and well, to boost my immunity and so forth. And what it's taught us is that the way we live our lives really is more important than ever. But we're also seeing long-term effects from the COVID virus. And people are going to be struggling with this for quite some time. And there's ways in which improving their lifestyle can help with that as well. So our challenge, like I said, isn't to become a faux psychologist, even though we want to study psychological theories about behavioral change to the max. But we don't have to change our careers. We need to be better coaches, more masterful coaches. and be able to coach with these very complex clients. Our challenge, it really, I think, despite working more in primary health care, despite working more with people with actual medical challenges, is to still be a coach. So it's incredibly important that we remember our scope of practice. This is something that members of our national board are starting to become more concerned about. And we have to remember that what we can do as coaches is really focus on how people can improve their lifestyles, but what they need to do really needs to be determined by people with the proper credentials. Now, this is the scope of practice statement that I was one of the people, I was actually the chair of the committee that developed this in our code of ethics. And what we came up with was that coaches really don't diagnose, we don't prescribe treatments, or provide psychological therapeutic interventions. What we can do, though, is provide expert guidance in areas where we're already holding some kind of active, nationally recognized credential. So if you are a registered dietitian, nutritional therapist, someone like that, great, go ahead and talk about that with your client. You can wear two hats. But if you don't have those kind of professional credentials, you need to stay in the coaching lane. This is really of key importance. To me, the simplest way to remember this is the what, the how, and the why of wellness and health coaching. Thing is, the what comes from the health educators, the treatment professionals, the fitness professionals, the dietitians and nutritional therapists, the other therapists, the physicians, the people that are prescribing the lifestyle prescription. You need to lose weight, quit smoking, get better sleep, improve your diet in this way and that. They can tell us what to do. Our job is to provide the how. This is where things break down. How many of you as other, if you are someone from another profession, like I know Isabella has a great background in nutrition, you prescribe this wonderful, eating plan, this whole meal plan that's been customized to that unique individual, and they don't succeed at doing it, at implementing it. That's where coaches come in. How are you going to take that and apply it in your life? How? That's what we work on together to co-create with our client a wellness plan that they can implement and be successful at. And our clients need to find the why, the motivation. Why am I doing this? Why is this important to me? So remember, our job is the how, not the what. I don't believe coaching training needs to be full of how to eat and how to exercise and so forth and so on and so forth. I just wrote a 412-page book on health and wellness coaching with nothing in it at all about the what. This whole book has nothing to do with what to eat and how to exercise. It's about behavioral change, successful lifestyle improvement. That's our job, being the behavioral change expert. I mean, think about it for a moment. How can you be an expert on all the dimensions of wellness? Now, how many dimensions of wellness are there? Well, what model do you want to follow? You can take on the National Wellness Institute's 6 dimensions. You can go after Jack Travis's 12 dimensions. Are you an expert at all of them? Come on, get real, right? So what can you be an expert in? Helping people succeed at changing lifestyle behavior and making it last. Making it last. I love to joke around and say that my first major book, Wellness Coaching for Lasting Lifestyle Change, was not titled, Wellness Coaching for Temporary Lifestyle Change. We've seen way too much of that already, right? We're pretty good at that. It works for a little while, and then what? So how do we do this? How do we get better at this craft of coaching? I mean, it really is about your transformation as a more masterful coach. And what does that mean for you? What does it mean to take your profession and see it as a craft? See it as something to deepen. And when we talk about craft, what are we really talking about here? You know, the subtitle of my book is Deepening Your Craft. Well, what is a real craftsperson? Well, clearly it's somebody with tremendous, high level of skill. They've worked at it for a long time. And they've got knowledge that has come through that practice. There's no way around the experience of working with people, applying what you know, and experimenting with it. We're also seeing, though, a craftsperson that knows their structure and methodology. You know, a sculptor that can do something like this knows how it works to cut that stone in a certain way, to get the effect that they want. There's a science to it, there's a physics to it. And likewise, we have behavioral science to work with. But a real craftsperson is able to improvise, they're able to create, to innovate. And they work in harmony with their tools. You know, if you see a really good craftsperson, whether it's a potter or a sculptor or a musician or a coach, they can kind of effortlessly reach for the tool they need and use it well. And they're dedicated to continuous improvement. It's not, oh, I got coach training, and I got my certificate and I'm done now. Now I just do coaching. There's no other profession where people are just done when they get done with their training. And ours is the same way, of course. You know, when I was an undergrad in psychology, way back in the Pleistocene, when we actually used to go into libraries and rummage around in the bookshelves and look for journals, I came across this amazing journal called Voices, The Art and Science of Psychotherapy. And I thought, wow, that's really different. And I was in a very hardcore behavioral psychology program, very demanding. But at the same time, I was also getting turned on to the whole encounter group movement and, humanistic psychology movement at the same time. And I was really intrigued by this idea of art and science. And that journal really spoke to both. That yes, there is behavioral science and research and stuff we need to know. There's behavioral change theories and all, but there's also an art to it. We take that theory, that science, that behavioral science, and we combine it with this art, and that's what gives us a craft. That's what we do. When you see somebody who's really good at coaching, it appears like it's effortless to them. And they're creative, and they come up with things and this right in the moment that seem to just really work. What's the difference? The way we apply all this knowledge. Now, years ago, there were two world-leading concert pianists. One was Van Cliburn, the other was Arthur Rubinstein. And Van Cliburn was known as just perfection. I mean, he was a master technician who played things perfectly. He could rip out 30-second notes like nobody's business and do it with incredible skill. He could play the Moonlight Sonata and people would say, oh, that was perfect. When Arthur Rubinstein played the Moonlight Sonata, as one critic wrote, you weep at its beauty. Now, what's the difference? The way that we coach is what's important here, and what we put into it. To be more masterful, we've got to be dedicated to that quality of coaching. But we also want to combine that with our own creativity, with our own imagination. And that's going to yield innovation. You know, we're in a young profession that is a little insecure. And like any insecure profession, have been so anxious to get all this research data accumulated and draw upon existing behavioral change theories for our legitimacy. And that's fine. Reaching for evidence-based training and information is all good. However, be aware of one thing. And this was something that Dee Eddington, who is one of the greatest of the health promotion people that we've ever seen. I was at a conference one time where he said, you know, if you only do evidence-based, you'll never innovate. Think about that. You know, we're in a profession here where we're working with people where it's very different than doing surgery. It's not like, oh, oops, I nicked an artery. Oh, too bad. You know, when we make a mistake in our coaching, it's not a big tragedy unless we're doing something way out of our scope of practice. We can back up and say, okay, well, that didn't work. Let's try something different here. So we have permission to innovate. And that's where the creativity comes. When we get to a certain point, whoops, let me back up one time. When we get to a certain point, our work becomes an artless art. Meaning, this is really what we're talking about here, to transcend technique. When we're beginning, sure, we're going to be very conscious of, am I using the right skills and so forth? But we want to get to this point. We want to go beyond competency to proficiency, to mastery. We want to stretch ourselves and stretch our clients to get out of that comfort zone of doing the same old, into that stretch zone, and maybe into the calculated risk zone to a certain degree where it's worth it, but out of that danger zone to make that distinction. There's a great little book that I'd recommend to you, and you might just quickly take your phone and take a snap of that URL, or you can just Google it and find under George Leonard. This little book, Mastery, the complete download is available for free. Wonderful book about mastery. And one of the things that Leonard talks about is the mastery curve. And tell me if you haven't experienced this, maybe in some other skill. Like I experienced in music and in skiing and so forth, where you're at a certain level and then you kind of bump up to a higher level. But then you hit this plateau for quite a while. It's not just continuous improvement, but the more you practice, then you get to a point where you bump up to another level. So what's it really mean? Taking this mastery further, I believe the key is our coaching presence. It's the way we are with people, not just what we are doing. This is what distinguishes the really effective coach from others. We throw this coaching presence term around a lot. To me, it's providing a way of being with our clients that provides the conditions that allow them to really open up, to maximally open up and grow. That's really what we're talking about here. And what we're coming back to is the good old Carl Rogers facilitative conditions of counseling and therapy that I believe are the same conditions that facilitate great coaching and add up to coaching presence. So when we look at it, this way of being is what sets up this coaching alliance. And every bit of research that's ever been done about psychotherapy or about coaching has said that the big deal, the most curative factor, the essential ingredient is the coaching relationship. It's not a fancy technique or recommending the right weirdo diet or, you know, the latest in whatever. It's about the way we relate to our client. I had one of our students say, I can hear tears. Now, if you're on the telephone with a client and they're quiet, how do you hear tears? We're talking about listening at a profound level. We're talking about being able to be so sensitive and so observant, such a keen observer, that we can pick up on the emotion, we can pick up on the tone of voice, we can pick up on the context, of what the client has said to the point where we know they're crying, even though they're doing their best to remain completely quiet. So how do we do that? I like to say we listen by scanning with all our senses, with our whole person. And the reason I have this picture of the Arctic here with a caribou antler lying there is I got kind of intrigued by this when I was reading Barry Lopez's magnificent book, Arctic Dreams, where he talked about walking with the Inuit people across the Arctic plains and when they were out hunting. And they would just go all day and walk and be quiet. And then at the end of the day, they'd sit around the campfire and talk about what all they had seen. And Lopez, who was a great nature writer and an amazing naturalist, had missed half of the stuff that they had picked up on. Things they had heard, things they had seen, things they had smelled, all the things they had observed by scanning constantly from where they're going to put their foot all the way to the horizon. In great listening, we have to be able to kind of incorporate this concept of scanning over all of our senses, picking up on all the nonverbals, doing all of this, and integrating it. So, moving forward, we need to be a resource for these educators, for these clinicians out there. We need to form alliances with them and show them our value, that we're not competitors, that we're not taking business away from them. We're helping them do their jobs better. They want their clients and their patients to really be able to succeed at the lifestyle prescription. We want them to be taking their medication properly and frequently as prescribed, and that's what we can help with as a coach. Again, clarity about our scope of practice. The wellness plan can support the treatment plan. There's an integration of the two. But all of this begins, I think, best when we have what I call a lofty intention. Don't just coach for the change of one little behavior. That's nice for a research project. But when we're working with a whole person, helping them to transform who they are. Remember good old Abraham Maslow's hierarchy of needs, right? The pyramid of needs, going from the basics of survival all the way to self-actualization. Well, there's a wonderful author named Chip Conley who in his book Peak talked about how do we transform from survival to success to something even greater. He was talking about it from a business point of view. He was a hotelier, one of the innovators of boutique hotels. And he was talking about how we focus on the tangible so much and we don't focus enough on the intangible. And what he said was that there are certain customer relationship truths that if we just meet their expectations, yeah, our business will get by, we'll survive. But if we go beyond that and we meet their desires, what they were kind of hoping to achieve, well, then we create loyalty. And if we go beyond that and get unrecognized needs met, then we create evangelism. Unrecognized needs. Did you know that you need 10,000 songs in your pocket? Apple figured that out. Look at them now, right? So what does this mean for us as coaches? Well, what if your client comes in and says, I want to lose weight, stop smoking, whatever. Great. You do a good job helping them with that. Ta-da. All right, their expectations were met. They were satisfied. That's great. But what about if you had that client who said, I came in there to lose weight or whatever, but boy, when I was coaching with Isabella, it was really cool because I was kind of hoping, I didn't really say it at first, but I was kind of hoping that I could manage my stress better, start sleeping better, improve my digestion. And you know what? That happened. That's really cool. I didn't expect that. I mean, I kind of hoped for it, but I didn't really expect it. But what if that person finished up coaching with Isabella and said, wow, I'm a whole new person now. I care about myself. I'm aware of my health and my wellness. I'm actively engaged in choosing the way that I live every day. I'm a whole new person now. That person is going to tell the world about Isabella's coaching. They are going to be her evangelista that's going to go out there and rave about what a masterful job she has done. Think about how you can help your clients to transform their lives. Not just meet a few SMART goals, change a few behaviors, transform who they are. Thank you very much. Love to take some questions now. And this is a great way to stay in touch. Please do.
Okay. Thank you so much. Michael, questions will be coming up thick and fast in a moment, I'm sure. But as they do, I just would love to say that I think you probably have been sitting in all day listening carefully to every single presentation in this conference, because your keynote, your conclusion has really cemented everything for us. You've talked about transformation, you've talked about scope of practice, you've talked about staying in the lane, the what, the why, and the how, which I stole from you after our conversation the other evening, and created a three-legged stool that I could share with our members earlier. You've talked about the art and the science and the craft. And we had this morning Dr. Dimple Devardis, who talked about her creative use of coaching out there in the community. And it has been truly wonderful. And you've talked about people in relationships. And I think, you know, this is the crux of it, really, that to have that skill, that craft, and the deep empathy and understanding of the other person and their situation, which includes all the biopsychosocial, emotional, environmental factors that impact on a lived experience. It is all music to our ears. It's something that we are absolutely committed to through our standards and through the way we want our coaches in the association to develop going forward. So I can only, you know, it's just been wonderful. Thank you very much. People, do we have any questions now for Michael? I'm just looking in the chat and waiting for them all to come in. So please go ahead and.
Yeah. Well, thanks, Isabella. Yeah, I really appreciate that. Yeah, I think what has always been part of my attraction to coaching, and maybe this is, you know, coming out of a, you know, therapy background. As a psychologist, I did therapy with people for, oh, I guess you might say about 27 years. And yet I've always seen the distinction between coaching and therapy. And I think sometimes when coaches aren't as comfortable working with emotions, they sometimes miss opportunities to empathize. And when you do empathize, the whole conversation changes. People start talking about what they really do need to talk about that is going to be essential for their success at achieving all these goals and, you know, action steps that we talk about with them.
Yeah. Okay, we have some questions. Faye Hall has asked, in the career progression of a coach, following qualification, when and how can a health coach expect to reach full mastery? Wow.
Well, yeah, you know, there will be coaches that work for 30 years and never get it. That never really achieve it. There's an old saying in, I think it's in music and martial arts and all kinds of things. It's called the myth of the 10,000. And where if you practice something 10,000 times, you master it. And yeah, it really is a myth. It's not just experience and repetition. It is that dedication to improvement. One of the things that I learned, I dug into when I was writing my new book is, you know, how do we get better at what we do? And some of the research was saying it's by practicing the difficult things.
Yeah.
It's not just by repeating the things we're already okay at. It's kind of like a musician playing the same old song, and they're pretty good at playing that same old song. But is there a more difficult song that they know they need to work on? And then they start to become more masterful. So amount of time, I don't think there's any way to gauge it.
Thank you. So we have another question here. Joe Fleming has said, fantastic presentation, thank you. I often start with SMART goals as a way of finding a way in to start making small changes in the first session. Would you recommend staying away from that technique altogether, or does it still have a place? P.S. I will buy your book for sure.
Great. I hope a lot of people do. To me, the way that I kind of learned how to work with wellness in general was to help that person take stock of their wellness. That is, help them to kind of take a look at and take inventory of what are their strengths, what are the things they have going for them, what are the assets that are going to make this journey of improvement of their way of living easier, better, more successful. And so in my first session, I'm really just kind of taking it all in, hearing that person's story, and I'm not really going for setting up a wellness plan. That comes later. But by the end of that session, though, a client does need to get started and feel like they are engaged. So setting up some kind of very doable action step with them really is helpful. That way they feel like, okay, I'm doing something between now and the next time I see my coach. So not a full-blown wellness plan, but yeah, maybe some kind of SMART goal or some SMART action step, I would call it, that helps them, make a little step forward, can really be good. But mostly what you're doing in that first session is helping that person look at their life 360 degrees, helping them get that bigger picture of where am I at and what information do I need to get? I mean, you might have a client that hasn't seen a physician for a medical exam in years and years. They have no idea what their blood work is or their blood pressure. That might be an important first step for them so that they can have more of that clear picture of where I'm at before we take a look at where I want to go.
Thank you, Michael. There are a couple of questions on, could you explain comorbidities, please?
Yeah, comorbidity is simply when we have more than one medical condition at the same time, and they're often very related. For example, having diabetes sets us up to develop heart disease. Excess sugar in the circulatory system ends up creating walls in the blood vessels that plaque can stick to. And so we end up with one disease kind of leading to another. Very often a person with heart disease will also have high blood pressure. There can be, a number of combinations, to say the least. Mm-hmm.
Thank you, Michael. There are a couple of questions. A question on trauma, which I think I picked up from Kate from the last session. But actually, we have a whole session, Kate, on trauma from this morning. So I suggest that you have a look at that, because I think it might take a good long while to actually respond to that question. A couple more. We've time for a couple more questions. Two people have asked us, new coaches. First of all, can you offer some practical tips to start on our path to masterful coaches, to being a masterful coach? And another question about how do we stand out as a coach in what's getting to be a much more crowded field? Do you have any comments on that?
One of the things that I've recommended to students that they have really embraced a lot is coach the widest diversity of people you can coach. A lot of times what will happen is a person is attracted to health and wellness coaching because of their own health and wellness journey. And let's say that you're someone who has successfully lost weight and improved your health, and you're a middle-aged man or woman, or you're at that point in your life, and you think, oh boy, I want to coach other people just like me to do just what I just did. And so you end up with a very narrow band of clients that you're working with. You won't learn nearly as much as if you coach the widest variety of people. I mean, coach people of every ethnicity, gender, socioeconomic level, you name it. The widest variety possible, because they will teach you so much and you will become so much of a better coach. I think that's a real key right there to begin with. The other is, don't get locked into just one path, whatever that might be. For example, in today's therapy world, a lot of people are obsessed with cognitive behavioral therapy. Well, guess what? That's only one of many, many types of therapy, even though it's the favorite one that's taught in graduate school these days. And don't think that because cognitive behavioral therapy is all the rage, that you as a coach can do it. You are not a psychotherapist. So be aware of that. Learn from it. Understand maybe how that helps people change thinking and change behavior. But be, again, careful about your scope of practice and see the value of it. But don't think that cognitive behavioral therapy is coaching. It's not. So, don't narrow yourself down. Be open to a lot of different approaches. Take in a number of different theories. One of the things that I did in my new book was cover all the major behavioral change theories in real depth. I was even fortunate enough to have my good friends Jim and Janice Prochaska edit the entire chapter on trans-theoretical model of change, the statement of change. So embrace it all, learn from it all. I think that helps us to develop more mastery.
Thank you. That's a great response. And finally, we have a very quick moment for, I think this is a really great question. Mandy has said, thank you for a brilliant session, and I'm certainly feeling more relaxed about coaching and working on my craft. My question is, how does group coaching work without sounding like you're preaching to your group? How does the coach balance their presence within the group to make sure that they are holding space for everyone?
I really appreciate that question, because we mostly just talk about individual coaching and how to. Group coaching is an additional skill, to develop, and taking a class specifically in that topic is highly recommended, especially a class in group health and wellness coaching, not just group coaching for executive leadership development. When we do group coaching, we are taking the same coaching process and implementing it with a group. And there's a couple of big advantages there. One is group accountability is incredible. If you get together with a group of people regularly and you start to trust them and care about them, and you say, hey, by next week, I'm going to do this. Believe me, you're going to do that. Because you don't want to come back to that whole group and say, oh, no, I just forgot about it. And, no, you're going to follow through. It's powerful. The other thing is the affordability of it. And you can reach more people. And it can also be a good tiered model. Maybe in your organization, you can't do individual coaching with everybody, but you can reach more people by having a group level where you reach more people, and then an individual level, to go beyond that. But really, it's applying the same process, and it's not, you have to be careful about blending education and coaching. You can do both, but you have to really be careful not to let the education part take over. Otherwise, we're not doing coaching anymore. Yeah. Instructive groups are great, learning groups, skill building groups, learn how to cook the Mediterranean diet. That's great. But a coaching group is about helping people change behavior and attitudes and beliefs that go with it.
Thank you so much. Okay, we really need now to thank Michael once again for his wisdom and plethora of information. I do encourage you actually to buy the book because it will be life-changing for you. Michael, thank you so much. It's been such a pleasure to have you with your wisdom as usual here. And I know that our coaches get so excited when they know that you're going to be around. So thank you so much for inspiring them again this afternoon.